You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, bioidentical hormone replacement therapy for women. What you need to know. My first guest is an expert on the topic, Dr. Beck. Dr. Beck, welcome to the program.
Thank you, Randy. It's nice to be here.
Now, West Palm Beach practice, is that correct? How long have you been there?
Oh, I've been there for about 8 years now.
Okay. So tell me a little bit about your practice. You're a gynecologist, is that right? OBGYN.
Yes.
So who's the typical patient? What are the different procedures you do? Because I guess you do surgery, you do just about everything.
Yep, I'm actively practicing OBGYN. I've been there
Okay.
for over 8 years, and we specialize in women's health and helping women take back their health from debilitating illnesses such as premenstrual syndrome, infertility, endometriosis, and menopause.
Okay.
And we're quite successful with that, working with natural hormones and nutritional supplements.
Okay, good. So let's talk a little bit about your background, your training, kind of how you evolved over the years. Because you say you're practicing much differently than you did years ago.
Incredibly differently, yes. So 8 years ago, I was a conventional obstetrician gynecologist. I was performing hysterectomies, fibroid removals, infertility procedures, lots of laparoscopes. And
Okay.
now the OR is commenting more and more that they just don't see me as often as they used to. My surgical practice is decreasing amazingly.
That's on purpose.
It's on purpose because we're solving women's health issues more and more with our nutritional counseling, exercise, and our natural hormone program, and our patients love it. And I love it as well. Because
so
really it's the way of the future. It's the way that it should be handled in the first place.
Is that right? So now you're involved in the American, in fact, you're going tomorrow. Headed to Las Vegas.
I'm flying out to Las Vegas tomorrow.
Tell me, now it's the biggest organization of its kind.
Right.
Where doctors from all over the world get together, and what do you guys talk about over there?
We talk about so many different things. There is stem cell research, there's cancer research, there's natural hormone therapies, there's nutritional supplements. And as you said, there are physicians from all walks of lives getting together and presenting their research. There are double randomized studies. They're throwing ideas off of one another. They're really the cutting edge of medicine, what's going on today and how they can move medicine ahead.
Okay.
So I'm really proud to be associated with that.
Do you call it anti-aging medicine? Do you call it functional medicine,
you can call
integrative?
It integrative, functional,
What do you call it?
anti-aging. I call it regenerative medicine, and I call it the medicine of the future, really.
It's like the new medicine.
It's the new medicine. I myself was trying to do a lot of self-training. So when I found A4M and I attended their
A4M
first
is
the anti-aging.
American Academy of Anti-Aging Medicine.
Right.
Go ahead,
When I
you
found
it.
them and I attended their first module, it was nothing like I had ever seen before, and I just had to be part of them. Because they really brought it together and they presented it in a really concise manner.
And you know, people are always emailing me, and I'm in San Diego, that's where our studio is, California, and they always say, well, do you know a gynecologist? I mean, not a lot of everybody wants the gynecologist as the female doctor.
Right.
And then when you have one that can focus or specialize in bioidentical hormones, do women feel comfortable with that? I mean, do you think and do you have a bias? Do you think that maybe you're better equipped to deal with women as a gynecologist, OBGYN?
I'm a classically trained OBGYN.
Okay.
So I have gone through residency, so
But do you
I know
think
what
it
that's
gives you
all
better
about.
insights a little bit?
Definitely.
Okay.
Not to mention I'm a woman on top of it. I've been through childbirth myself. I've had PMS, I've had fatigue, I've had all of that. So I have an insight from a totally different aspect, and I've had to figure it out on my own over the past 5 to 8 years. I've been there. And I've taken a lot of what I've known and figured out for myself, and I bring it to my patients.
And you have a busy practice. Now, do people travel? People drive to see you?
People are
sometime?
driving a good 2 hours sometimes to see me.
And you're a mom?
Yeah, I'm a mom of 4 children.
Okay, so
and
you're
in fact,
busy.
they're very upset that I'm here doing this.
Is that
But
right?
because, you know, they're left at home.
So maybe if they watch the show, that they wouldn't mind you coming out here. Maybe you need to make them watch the Wellness Hour a little bit.
I think once my children see what I'm excited about and how excited about what I'm talking about, that they already know what I'm traveling around trying to learn. They know how much I love what I'm doing, and they've been to my office. They've seen my patient and excited about what we're accomplishing there.
Okay.
And some of them are even talking about maybe going into what I'm doing.
So menopause, let's begin there, because I guess that's the typical patient that we're talking about with natural hormones.
Yes.
What defines menopause, in a way?
Well, menopause typically happens at age 52.
Okay.
It can be hot flashes, it can be fatigue, it can be trouble sleeping, It can be decreased libido.
But you say it happens a lot sooner than 52.
Yeah, it can happen 15 years before that.
Okay.
With irregular periods and heavy periods.
So brain fog is one of those
brain
symptoms?
fog, just kind of your memory kind of going. It can be all sorts of symptoms. Lots of cyst in your breast, fibrocystic breast. That's all part of perimenopause. So a lot of people will come in and their periods are getting closer and closer together and heavier. They don't realize that that's part of heading into menopause.
So is that a hormonal problem? I mean, when you hear a woman goes to you and says, I'm getting irregular periods.
Oh, that's the first thing I think of is what age is she? So as soon as we're heading into our late 30s, early 40s, you're starting to head towards early menopause. Or perimenopause, whatever you want to call it. But your hormones are off.
So those symptoms like PMS, you say, exaggerated, just they don't feel right.
They're all kind of related. It's all a different spectrum.
Can't lose weight the way you used to, you say?
Can't lose weight, just not feeling right. The afternoon crash, needing to keep yourself going.
You say it's affecting their marriages. I mean, women tell you this on the...
So many women are coming in telling me they just have no sex drive. They had a high sex drive in their 20s, and now it's down to nothing. They've had maybe a child or two.
Okay.
And they have questions on how to make this better. And believe me, their husbands definitely have questions on it. So they want to keep their marriages going. They want to be their old selves. They don't understand what's going on. And that's when I explain to them, this is their hormones, this is their nutrition, this is their sleep habits. It's more so than, they don't necessarily need antidepressants like every other physician is telling them.
Have you had people that come to you, women, let's say 40, 42, 45 years old, they're starting to get these symptoms, and they've been told you need Prozac or you need an antidepressant? Too many.
Too many.
Like every day.
I have so many women coming on to me on one antidepressant or another, being told that they need birth control pills or whatever else, when really all they need is someone to sit down and go through their symptoms with them and really take time with them and explain to them how to approach their health naturally.
Now you have the luxury of time. I mean, you're different than the typical gynecology.
You know, I'm not different than the typical gynecologist.
No?
The thing is, I make myself slow down. So I see less patients in a day.
All right.
Okay, I purposely make myself do that. It's a little less productive, but my patients benefit from it. Okay. And so I could be churning it out like the normal OBGYN, but I make myself individualize the treatment to each patient, and we try to put them through our program. And because of that, each patient is benefiting. So they're going to take control of their health. They're going to feel like they really have the education that they need at the end of the day, and they're going to feel better in the long run.
So the natural hormones, aside from getting them out of their symptoms,
right?
I mean, do you have patients that once you kind of put it all together, the nutrition, the exercise, the hormones, the de-stressing, and getting them back to sleep?
Don't forget the sleep.
Do you see them all of a sudden going, oh my goodness, I feel fantastic? I mean, do you see reversals in symptoms?
Yes.
Like every day,
in fact,
every week?
Well, just the other week, I had an ICU nurse, high stress.
Okay.
Used to be me. Still is me, really.
All right.
Come to me, and really her marriage was on the verge of breaking up. She had had a hysterectomy maybe 3 years prior, which really 3 years prior, this is the time where your hormones are at the lowest. Okay. They had left her ovaries. She wasn't having the typical hot flashes, so no one else was really putting it together. And her husband was at wit's end with her. Her libido was down to nothing. She didn't want any sex, okay? And that was not her. She had...
So she just comes in on consult and kind of confides in you and all these things across the board.
Yeah, she had been put on the classic
antidepressant. And is this something you hear every day? I mean, when they're telling you this, you're going, wow.
And I had known her for a while. I hadn't done the hysterectomy.
Okay.
And I said, you know, this just isn't you. Her energy was down. She had already had her thyroid checked and told that it was normal. So we went ahead and we did some hormonal checking. And sure enough, her testosterone, her estrogen, everything was down to almost nothing. Very, very low normal. So we put her on some natural hormones, and probably within 3 weeks, she got her energy back.
What did she say?
She was so grateful. I receive emails from her like every week telling me that we saved her marriage.
Is that right?
Is this
the happiest time of medicine for you, by the way?
It really is. I wake up in the morning, I'm excited to go to the office. So it used to be that I was excited to go to the OR. Now I'm excited not to be there.
Is that right?
I'm excited to show up in my office and actually see my patients and sit down with them and go through their symptoms and show them how they can approach their health naturally.
Okay.
What I don't get excited about are the people that have seen so many of the physicians come in really frustrated and think that they know everything and don't want to take the time to really kind of start from the beginning.
Okay.
So they come in with 500 different supplements. They're doing all their research on their own and they know it all. And then they don't want to start from step one.
Okay.
You know, because there really is there is a way to go through this.
There's a lot of confusion out there, by the way.
Yeah, everyone's trying to do it on their own. You know, we've got so many.
But it's hard to find a
magazines
doctor, though. I mean, I'm not trying to endorse you, by the way.
Yeah, no,
I mean, I
it
do
is
agree
hard.
with the association with
Right.
the American Academy of Anti-Aging Medicine. You're also in their diplomat program. Is that correct?
Yeah, I'm in their fellowship, basically.
In their fellowship, and you know, good for you. Okay, so I want you to take me through the process of some of the testing you do, and then I want to find out a little bit more about the commonly replaced hormones, what you're replacing.
Okay.
So let's start with on day one. Okay, so a woman goes to you.
Right.
And
so
what happens?
A woman will come in, we'll sit down, we'll go through an extensive symptomology. Okay, so they'll write down everything that they're concerned about so that we're on the same page. And then she'll leave with an extensive lab analysis, maybe salivary analysis, urinalysis, depending on what that symptomology showed. Then she comes back, we'll go through everything.
So you're going to do testing. You say
Yes.
maybe saliva testing, blood work.
It'll
what
really
else?
depend on what symptomology we're
okay.
going over.
Okay.
Okay, so it's not that we just have one test panel for everyone. Okay, so it's really going to depend on what kind of problem they came in with.
All right, all right.
And what age group they are too, because not every patient needs the same sort of test. When they come back, we're going to go over all those labs and make suggestions based on that. And then at some point, we're going to sit down and go through an actual nutritional counseling with them too. We're going to detoxify them off.
Do you have nutritionists that work in your practice as well?
Yes, I've gone through a big process to train some nutritionists to sit down and discuss what foods are good for them, what foods are not good for them. And along those lines, we're going to discuss with them some food testing. So some people
Do you
might
do like
not,
food allergy testing? Is that right?
That's what I'm trying to get at.
Okay.
Yeah. So some people have been to allergists, but they're not actually having obvious signs of allergies. They might just be what we call food sensitive.
All right.
So it's not that they're eating something and they're breaking out in hives, but maybe they're getting migraines 6 times a month. 6 times a month, like I was. So I wasn't putting 2 and 2 together.
Interesting.
Until I did my food
So the migraines
testing.
might be a food sensitivity
Migraines,
or allergy?
fatigue, anything that would be considered an autoimmune disorder. So people that are having joint muscle aches. My brother-in-law is a radiologist, so a very intelligent man. He got to the point where his entire right arm was swollen and he couldn't move it. He's in his mid-50s. So it was keeping him from working. It was keeping him from doing what he loved to do every day. I said, please let me just pay for your test panel, because I don't mean to be mean, but some men can be a little stubborn. So I had to
Well, men do wait until everything's falling apart right before they go to the doctor.
So
Okay.
I actually paid for his panel, and it was chilies, mushrooms, and some nuts.
Were his food allergies?
His food allergies.
Interesting.
I said, just stay away from these for 3 to 4 months. It's not going to hurt you to not eat these foods. Let's see if it
Was he
improves.
eating them every day?
Every day, because he loved it.
Okay.
Yeah. The next time I saw him, because he actually lives in another country, he came up and gave me the biggest kiss, and he was moving his arm entirely. He had back his life.
Very interesting. Very interesting.
I did my own food panel, and it was tomatoes and pineapples, which are very healthy foods, but they're not healthy for me. So tomatoes are very low carb. It's considered a free food in any sort of diet, and it's not good for me. Pineapples, I put in my smoothies all the time.
So this food allergy or delayed food sensitivity.
Right.
So the next day, you might
It
just
could
feel a little
be-
lousy.
You feel horrible. And it's
Interesting.
just that your immune system is reacting to these foods in some manner.
So you're
And it
big
could
on
be
this
all-
testing, this
very
kind of
big
testing.
on this testing. A lot of times that's the main test that I'll try to talk people into, other than the other type of testing, and it really does make a big difference for people.
Okay, good. So with natural hormones, are they safe? I mean, is the science out there now saying it's safe if done correctly?
If done correctly, that's the important part. All tests, all therapies have benefits and risk. So there's no one thing that's absolutely safe. Okay, so I get upset with people that are doing bioidentical hormones and then just hand them out like they're candy and don't do the appropriate follow-up test.
When you say you get upset with people, other doctors?
Other whatever they want to call them.
Okay.
Natural practitioners.
Okay.
Or physicians. Okay, so I got upset with myself. Okay, because When I first started as a allopathic physician, we would hand out hormones and keep people on until they were 90, thinking that they were harmless.
Like Premarin and things like that?
Exactly.
Okay.
Because they were harmless. Well, then the Women's Health Initiative came out showing an entirely different situation.
The synthetic hormones were bad?
Yeah, of course.
Okay.
So they increased stroke and heart attacks.
So what you're doing is not that.
We didn't have that data then.
Okay.
So I tell all people that sign on for our natural hormone therapy, if you're going to be part of this, you have to sign up for the follow-up testing too. Okay, it is going to change
because
your
you
life.
have to adjust the hormones?
You have to make sure that all of your hormones are in safe levels. That's the absolute point. So no one hormone is all good or all bad. So you feel the best when your hormones are in safe levels.
Do you believe the second half of a woman's life could be the best half? I mean, she could feel the best?
Absolutely.
I mean, you believe that?
Yeah,
okay.
I really do. Aging does not have to mean that you get a disease process. You just have to know how to age gracefully. And you have to know how to keep your sleep in the correct manner. You have to know how to exercise. You have to know how to take care of yourself.
You get them to go to sleep?
Eventually.
Okay.
Believe
so there's
me,
like a healing
getting
process for certain
someone to
people.
sleep when they're supposed to is probably one of the hardest things that we do in our office. That's not an easy task, but it is possible, and it doesn't need medications that you take every night to knock yourself out, for 10 hours to where you have a hangover in the next morning. But it is possible to do that naturally.
So natural hormones. Let's talk about bioidentical hormones. What are the commonly replaced hormones that you work with in your practice?
The most commonly replaced hormones are estrogen, progesterone, DHEA, testosterone, and thyroid.
Okay, so let's start with testosterone. I don't even think of women as having testosterone levels. Okay, so the women that are coming in 40 plus, 50 plus, and this is for people in their 70s and 80s as well?
Definitely.
Your program?
Yeah.
Okay.
Anyone from pretty much mid-20s on can be having hormonal issues, and really, even nowadays, mid-20s.
Okay, so 40s. They're in their 40s. What are the symptoms of low testosterone in a woman? How does a woman know?
Okay. Testosterone is mainly a hormone of growth and support. Okay. So really, when I think of testosterone, I think of muscle support, and muscle is your metabolism.
All right.
So really,
heart's a muscle, obviously.
Right. So testosterone is going to be your metabolism. It's probably one of the main reasons why people can't lose weight after a certain age.
All right.
Okay, and that's men and women. So it's a lot of reasons why you can't lose that bulge in the middle of your belly. So we all know that no matter what exercise and diet that we do, that sometimes you just can't get past that plateau. And so I've really found testosterone to be helpful in that aspect for women.
So if you can't lose weight the way you used to, you may have a low testosterone.
Exactly.
What's another symptom?
So weight loss, fatigue, decreased libido is a huge one. Osteoporosis. So anyone that's having osteoporosis should be definitely looking at testosterone levels.
So specifically women that had a libido their whole lives and all of a sudden it's gone.
It's gone.
Could be low testosterone.
Definitely.
Interesting. Okay.
And specifically for men, a change in their mood. So increased anxiety, depression, not having erections anymore. So I have another friend that her husband started doing testosterone injections and his erection came back. And they're both extremely happy.
Now, is this true? I mean, I think you told me this on the phone. You said that you balance the women's hormones, get them feeling better with nutrition, the right kind of exercise, get them to sleep, and they drag their husbands in.
Yeah.
Or their partners
Yeah,
in.
they drag their husbands in. And in fact, I have another friend that I literally chased around with the cortisol, with salivary testing. And he's been hearing me talk about testosterone for ages, and he refused to do it. He picked up a men's magazine and read about testosterone somewhere, and then said, "Did you realize that?" It made me so upset. So he finally started doing the testosterone.
That's like what you've been telling him all along, but he has to pick up a magazine.
I don't know anything because I'm just an anti-aging physician. Anyway, he finally started doing the testosterone cream, and he lost 10 pounds in a month.
Is that right?
Yeah.
Now, do you have women, though, that maybe they never really had a big libido, that show up on the test with almost a non-existent testosterone, you give them a replacement?
Yeah, and they absolutely demand it. So
Oh, really?
the minute they get their hands on a little bit of testosterone cream and it improves things in the bedroom, they will not let me take it
And this
away.
is prescription medication, right? I mean, made by a compounding pharmacist?
Yeah.
Injected? Is it a cream?
In fact,
what is
I can't prescribe it for myself. It's so controlled.
Oh, really? Okay, so, but how do you put it on? I mean, is it a cream? Is it an injection?
It's a cream
pill?
or it's a gel.
Okay.
And sometimes for men, it can be an injection.
All right, all right. Thyroid hormone. Tell me about that. How does a woman know if it's low thyroid?
Thyroid has so many different symptoms that it's missed time and time again by practitioners. So it's, of course, everyone knows about fatigue.
Okay.
It can be hair loss, hair thinning. It can be puffiness around the eyes, dark circles. It can be thickening of the tongue to where you actually have little divots where the teeth are kind of sitting around the tongue. It can be a lump in your throat. It can be enlarged thyroid. It can be dryness of the skin, so much so that you're having to put on lotion, but you never quite feel that your skin is not dry. It can be coldness of the hands and the feet.
So cold hands and cold feet?
Yeah.
Thyroid?
Yeah, always
or
having
cold,
your hands
I guess,
cold.
in general?
You know, those people that just come in with their hands blue and they don't know why?
Okay, all right.
It can be your nails brittle. They're breaking off, but you used to have great nails when you were younger, okay? But they're not nice anymore. They just keep breaking off. It can be heavy periods. How many people come to an OBGYN with a heavy period? It can be irregular periods. Okay. It can be infertility. It can be difficulty getting pregnant, recurrent miscarriages.
Is it common? Do you see a lot of your practice women that have
if someone's having infertility issues, I check. That's the first thing I check is their thyroid.
And did they say this is the first time anybody's ever really focused on my thyroid?
It might not be the first time someone's checked their thyroid, which makes it even worse.
Do you look at it differently?
Missed.
Do you look at it differently than
we
maybe
run
standard?
a much more extensive panel for the thyroid than they've ever seen before.
Okay.
So, and we have much stricter values that we look at. So we recognize subacute hypothyroidism a little more often than the general practitioner.
And weight loss, by the way, that could keep people from losing weight if they have a thyroid problem?
Definitely. So you have to look at symptoms and not just lab tests.
Okay.
So if everyone's having these symptoms, sometimes it doesn't really matter what the lab tests are saying.
Okay.
So you really have to put the clinical picture together. So the lab tests are just that, they're labs. If someone has all of those symptoms, they still might have hypothyroidism.
So thyroid is a pill?
Yeah,
most of the
thyroid
time?
is a pill for the most part.
Okay,
yeah.
and you work with a local compounding pharmacy, and so do you call it the hormone program, or what do you call it?
We call it our natural hormone therapy program.
Natural hormone therapy program. Okay, so now we talked about thyroid, testosterone. Tell me about progesterone.
Well, progesterone is one of my absolute favorite hormones in that so many people have problems with it.
Do you take progesterone?
Of course I do.
Of course you do?
Of course I do.
So it's your favorite hormone. Tell me about it. I mean, what's it responsible for?
People at a very young age start having problems with their progesterone. So it is the hormone that keeps your cycle regular.
Okay.
And it's the hormone that's used up first when you're really stressed out. So how many people have that?
That's right. Everybody's stressed.
Drives
down your progesterone, you're saying?
Drives down your progesterone. So sometimes just using a little bit of a cream in between your periods will keep your periods light and regular.
Now you say it's a feel-good hormone on the telephone.
It really is.
What does that mean? What does that mean?
It makes you feel better. It makes your periods lighter. It's a natural diuretic, and it pretty much is the cure for a lot of the PMS symptoms that women come in and see me for every day. So just a little bit of natural micronized progesterone will take a lot of those symptoms away.
These are creams.
It can be creams or it can be pills.
Okay.
So
Do you prefer?
I usually prefer doing it in a capsule because the capsule crosses the blood-brain barrier better than the creams do and will help people with their sleep disorders.
Oh, okay.
So by doing that, we address two problems at the same time.
Do you think it's protective? I mean, the Society of Anti-Aging Medicine. I mean, do you think it's protective? Do you think it, we've talked, you say it, to delay the onset of these diseases associated with aging? I know it's hard to prove prevention, but
it really
do you
is
believe
hard.
that? I mean, do you believe that?
I absolutely 100% believe it. Otherwise, I wouldn't be involved with this.
Anything else about progesterone before and we are almost out of time?
Well, really, it's not just progesterone. It's really the ratio of estrogen and progesterone.
Okay.
So it's not so much that progesterone's low, it's that a lot of times that estrogen's really high.
Okay.
That gives a lot of people their symptoms. So the more that we're doing exercise and the more that we're eating things that are good for us, such as the green leafies, the more that it helps balance out our estrogen levels.
Okay, good. This is a big topic and we're almost out of time. This neurofeedback, that you're doing. Tell me that part of your practice.
Well,
and you incorporate that with these women.
Right. Neurofeedback is something that we've been doing for the past 2 years with our patients, and we find it integral in addressing people's insomnia issues. So it's wonderful for people that are afraid of hormones for some reason or just can't keep up with their supplements. So the people that are on medications only get 30 minutes more of deep sleep. And that's something that they don't realize. And they're taking a medication that they can get addicted to, and they end up with a hangover in the morning. the neurofeedback can get them 2 hours more of deep sleep. And it's something that is no radiation exposure. They're not going to get addicted to. Once their brain gets the therapy, once the brain gets the hang of the therapy, it's permanent.
Okay.
So it's wonderful. My patients absolutely adore it.
Now I'm going to interview the person that one of the distributors of this technology.
Right.
And I'll give you that video so people that are watching this can watch the rest of the story on your
Wonderful.
website and hear about that. And so you, what percentage of the women that go in that have these hormonal problems or feeling lousy, are you using this biofeedback?
I mean, right now I'm only using it on 15 to 20% because not a lot of people understand it, but I would love it if my practice would sign on for it.
Have you used it?
Oh yeah, I use it on myself. It helps me sleep better, and it helps me not be so anxious all of the time. So, you know, us high go-getters, we're a little overactive.
Okay.
So we can have some
And you do it
problems with
right there
sleep.
in the office?
Yeah, yeah. It actually involves just putting on a little light glasses and putting a little light therapy and sitting there for 30 minutes, and then you're done with the session. So it's most effective if you can do it twice a week.
Is that right?
And it typically takes maybe 20 sessions.
Is that right? And then they feel better, go sleep
They feel
better.
they feel more clarity, memory's a little bit better. You just feel better about the world, really.
So women out there, and we're out of time, they're watching this, they feel lousy, they're in their 40s, irregular periods, fatigue,
all of that.
You could do something about it.
Definitely.
There's more out there than just take a birth control pill. And what else do they do? What's the other?
Here's your antidepressant.
And here's your antidepressant.
Yeah.
Have you saved people from antidepressants? That means they were already told you've got to be on an antidepressant?
If they come,
if
they come in with an antidepressant, I tell them to stay on until we're through the program. But eventually they'll wean off of it.
Have you weaned off a lot of women over the years? Antidepressants?
Very slowly, very cautiously.
But you have?
And with the consent of their psychiatrist.
Okay. And have you, though? You have weaned them off?
We have, time and time again.
Okay, good. I want to thank you for coming to the show. Final message, a woman watching this.
Thank you for inviting me.
And she wants more information. She could go to your website, make an appointment.
drbecktorres.com. Yep.
All right. I want to thank you so much.
Thank you.
Interesting stuff. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. Beck or Dr. Beck Torres. It'll be both, or bioidentical hormone replacement therapy. For now, I wish you good health.